What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering some of the image control / quality control, the quick fix type of situation. So to give you context, I am a night shift X-ray tech. Been doing it for about 4 years. So what I mean by this is, imagine you took an X-ray, right? Let's say a chest X-ray. Let's go with T-spine. T-spines are more notorious for not looking good, right? Let's just say T-spine. And if you're watching this video, you probably live in America. America is known for not having the healthiest of people. And you have Bubba, let's go with Bubba, who comes into your ER who weighs about 350 pounds, which is the limit on your X-ray machine, right? He comes in and you go to shoot him. You're brand new to the field. You use the default technique to large patient. You shoot it. You get the lower C-spine, the lower T-spine. Okay. You try to get the middle. Can't see nothing. You get the upper almost C-spine, but you're still missing essentially the upper T-spine and the middle of the T-spine. So you have a few things. You can adjust the technique a little bit and you shoot it again. Nothing. Okay. So don't freak out. There's a few things you can do. If you're by yourself and you don't have a veteran tech who knows his equipment, the veteran tech always sets a technique, especially for T-spine, and majority of the times you're probably using shitty equipment. Majority of the times our equipment is not good, whatever. So if you use a fixed technique, like where you set it, it all kind of depends. Certain machines you need more KVP, other machines you need to adjust the mass. You both need to be careful not to shoot it, like to overshoot too much KVP and not enough mass, because then it won't penetrate it, or it won't penetrate it but then it'll get burnt out. So it's like a guessing game and you have to tweak it. Where I work at, majority of the times, if we run it under large and then we switched and we set a technique, majority of the times we just have to bump up the mass on ours and it just kind of works out good. But you have to kind of tweak that part aspect of it. Or sometimes if the patient's really big, depending if you did it on the wall bucky versus laying down on the table, your table has better images. It can get better images because something with the bucky, the wall bucky, and the laying down, usually the one that's laying down can take heavier patients or heavier load, so you can get better images on the table. So if you try to set a technique, you try to adjust your AECs on the technique and it still won't work, you can try a breathing technique. You can always try kind of angling the tube. You can always try running it under like L-spine. There's different type of things you can run it under just to get better exposure. Sometimes, regardless of what you do, these patients are just so big that it doesn't matter how much adjustment of the technique, it's just gonna look bad. I'm sorry. There's been times where we had the veteran tech / the manager try to save some of these X-rays and they try setting their own technique, do their own thing, and it just doesn't come out good because the patients are just so broad. Sometimes, especially for any exams that you have to shoot laterally, you turn the patient to the sideways and you have them turn. Depending on how their adipose tissue sits, some people are more broad sideways, so it's harder for you to even penetrate. Other times the people just all their weight is in their belly, or some of the people just hold all their weight in their hips. You see it all. So like you can get like the AP perfectly, but then the lateral sucks, or vice versa. You get the lateral good, but then the AP or PA, whatever, it just doesn't come out good. So when in doubt, always, go ask someone else. Go ask set a technique. Laying them down on the bucky, like I'm laying them down on the table, will help improve your images. But sometimes, if they're just so big, there's nothing you can do. Like it's the sad truth. Sometimes they even CAT scan, like they're too big or the images is not good, that they literally will tell the patient you have to go to the zoo to get your scans done, which is something that is sad. But if they're that big, that's something that can happen. Yeah. It's been your boy Miguel. See you on the next one.